Hi everyone. So today we are going to talk about introduction to secondary data. So what is secondary data? It is data collected by anyone other than you or your team. So primary data is data that is collected by the same individual or a same research team, whereas secondary data is data which is collected by someone else. So this secondary data can be used to examine a specific research question other than that for which the data was initially collected. So when the data collection began, there must be a specific research question that was formed to collect that data. However, secondary data are usually so vast that these vast secondary data sets can be used to answer research questions other than the initial research question which was formed at the beginning of the data collection. And some examples of secondary data set are the enhanced data set. Enhanced stands for National Health and Nutrition Examination Survey. There is also NHIS, which is National Health Interview Survey. Then there is BRFSS, which is Behavioral Risk Factor Surveillance System. And then there is the SEER data set, which is surveillance, epidemiology, and end results data. So these are some examples of secondary data sets. Please feel free to Google these names and learn more about these data sets, or just to see what secondary data sets are all about. So there are several sources of secondary data sets. Large-scale government-funded data can be a secondary data set. A university research study data is also a secondary data set. Then there are state or county level data records. So this is something that we are seeing right now. The state and county level health departments are collecting enormous amount of data, not only on the number of COVID cases, but also on the number of people who have been vaccinated in each state and each county. So this is an example of a secondary data. Also, there can be district level data, which is K-12 school records, is also a source of secondary data. So secondary data sets are always available for a large number of subjects, and it has various research areas. So right from infant data, childhood data, to adolescent data, to older people, there are a lot of different areas of research which are available in secondary data sets. And secondary data is quantitative as well as qualitative. So I hope you all know the difference between quantitative and qualitative data by now, especially because most of you will be doing your community practicum the coming semester in spring. And for your practicum, one of the requirement when you do your project is that you work on both quantitative data, which is numeric data, number data, and qualitative data, wherein you collect information from people in the form of focus groups or key informant surveys. So that is qualitative data. This data, which is secondary data, is usually publicly available for various epidemiological study designs. And most of it is freely available, but some of it is also a paid data. But secondary data sets are usually publicly available data sets. So where do you find secondary data? These are several websites wherein you will find publicly available data. So there is government data. You can check out this website, data.gov, and you will find a lot of data, which can be anything ranging from environmental health to childhood and adolescent health to maternal health to cancer survivors to census data. You will just find a lot of data. The second is university data. So there are certain universities who prepare their own studies, and then they collect data for their own study, and this is a university data. So you will find one such data on the University of Michigan website, which is umich.edu. So go and check out this particular website, wherein you will see that University of Michigan has been collecting a data set for more than a decade now, and it has several different types of variables, and they have made this data set available for anybody to use. So please go and check this out to see what a university secondary data looks like. Then, as I said, there is Census Bureau data, census.gov. This is obviously a population data. Then there are also international databases. So international databases, you can check out this particular website, which is related to census.gov slash international / international, where you will find data related to different countries, and then you can click on that specific country where you wish to do your study related to a particular public health problem that is associated with that country. So this is international data. Then, as I said, there are various age groups. So this is one example of early childhood data. So early childhood data is basically a longitudinal program. It's a birth cohort. So this is the website where you can go and check out what this data is all about. Again, this is a publicly available data since it is .gov. Then there is country specific data. So for example, the United Kingdom has a data service wherein they have a lot of cohort studies and longitudinal studies which are going on. So you can go and click on this particular website over here to see how country specific data looks, and it will differ from one country to another country. But here I'm just giving you an example of one nation, which is the United Kingdom. And lastly, there is disease specific data. So, of course, so many of you in your introductions said that you want to work for the CDC, you want to work for the WHO. So, CDC has a vast library of data set, especially secondary data sets. And under that, you will find a lot of different diseases. And here I'm just giving you one example of a disease specific data, which is overweight and obesity. So particularly mentioning this example because overweight and obesity is projected to be an epidemic in the United States in the next 10 years by 2030. So if you're interested, you may want to check out what this data looks like and how it is collected. So what are the benefits of secondary data? The research design and data collection is already completed, so we don't have to worry about that because we are getting a data set which is already prepared, and we only have to read through the PDF manuals to see what research design was used. Second, we have direct access to this national and international data that would otherwise actually be a lot of time consuming process, and most importantly consuming a lot of resources. So here, sitting in the United States, you are having access to data from the United Kingdom, data from any other nation like maybe Kenya, or data from China. So you can have data from a lot of different countries. So this is another advantage of a secondary data set. Also, it's a higher quality data. So since this is collected by larger organizations with good funding and good resources, they have a large team of people wherein they have a huge, not only a huge data collection team, but also a very good team of analysts and a team which does the data entry. So it's pretty thorough. So this is one of the advantages of secondary data, that it's a very high quality data. Also, there are large sample sizes, and large sample sizes are always good, especially for epidemiology, because it is more representative of the general population. So, usually, if you think of designing a study by your own self, and let's say you want to collect data from elementary school children, then it is going to be quite a task because you will have to take permission from the parents or guardians, and children come under the protected subjects. So whenever you want to work on any kind of data which is related to a population which you think you might not have easy access to, it is always good to see a secondary data set which has already covered or which has already collected information on that particular sample. And whatever sample size you select, it will be representative of that general population. So if you select a sample size of child and adolescent health, whatever sample you work with, it will be more representative of the general population of children in that particular age group. So that is the benefit or advantage of a secondary data set. Also, there are a large number of variables to answer various research questions. So as I said initially, that when the data collection begins, it begins with one research question, one broad research question. But as the study goes on, there are more variables which are being added to that initial study, which started maybe 10 years ago. And therefore, you have a large set of variables, and you can take a look at these variables when you download the dataset, and you can use it to answer various research questions. So I am going to teach you in this, I'm going to give you a demonstration on how to actually access secondary data, what is a code book, what it looks like, how to get familiar with the variables in a secondary data set. So we are going to talk more about it in the next lectures. So what are some of the disadvantages of secondary data? The data is not directed towards a specific research question. So let's say you have a specific research question in mind where you want to see something, a research question which is related to infant mortality and sudden infant death syndrome. Let's just take that as an example. However, the data which was collected was not collected to answer your specific research question. So that can be a disadvantage sometimes, because you may think of more variables and more covariables which you would like to include in your study, but those variables may not be present in the secondary data. So you basically have to work with what you have in that secondary data, because you don't have the control or the liberty to add more variables to the study unless you are designing your own study and collecting your own data. So that becomes a disadvantage here. Next is information on study designs and data collection methods may be scarce. So yes, there are code books, there are PDFs wherein you will learn about how the data was collected, and you will also learn about the data collection methods. But sometimes the information which are given by some secondary data sets, the information mentioned on the website may not be sufficient for you. So that can be a disadvantage. The constructs may be defined by a single survey item. So construct is a term that is usually used in research which is done in the field of social and behavioral sciences or psychology, but it is not incorrect to use it in epidemiology as well. So construct is basically a variable. So any construct is defined by a single survey item, because you're just asking them one single question, such as how many, it can be just one single survey question, um, how many trips did you take in the last 1 year? And here you are trying to gauge the international exposure of that particular participant, and you want to study their environmental exposure related to their lifestyle or health outcomes, let's say. So when you're asking just one particular question, that particular question becomes a single survey item, and that single survey item is actually nothing else but a variable, which is also known as a construct. So this particular thing may actually lead to concerns of validity and reliability. So whenever you collect your own data, you always do a validity and reliability test to see how good the data is, and can it be used for statistical analysis. Whereas in a secondary data set, this can be a disadvantage, and you may have to run additional validity and reliability tests. And also, it may be of less value in experimental study designs. So whenever you're designing any kind of clinical trial or experimental design, it's always better that you collect your own data, because working with a secondary data can turn out to be a little tricky, a little cumbersome, and that can act as a disadvantage. So this is all about secondary data sets, and we will talk more about sampling designs and survey weights in the next lecture. Thank you.